Schizophrenia. Describe and evaluate the classification and diagnosis of schizophrenia, 16 marks. Schizophrenia is a psychotic disorder whereby individuals fail to distinguish between reality and fantasy. There are a number of symptoms characterized with schizophrenia that can be grouped into positive and negative symptoms. Positive symptoms are additional behaviors and experiences that would not normally exist, whereas negative symptoms represent a withdrawal or a lack of function that you would usually expect to see in a normal person. Positive symptoms. There are two positive symptoms, hallucinations and delusions. So hallucinations are sensory experiences that have no basis in reality or distorted perceptions of real things. They're experienced in relation to any sense. So, for example, hearing voices or seeing people that aren't really there. Delusions are beliefs that have no basis in reality. So, they make a person with schizophrenia behave in ways that make sense to them, but seem bizarre to other people. So, for example, believing that you're the victim of a conspiracy or that you're someone famous, like the Queen. Negative symptoms can involve avolition, so severe loss of motivation to carry out everyday tasks, so for example work, hobbies, personal care. This results in lowered activity levels and unwillingness to carry out goal-directed behaviours. Speech poverty is the next negative symptom. So a reduction in the amount and quality of speech may include a delay in verbal responses during conversation. DSM emphasizes speech disorganization and incoherence. Classification of schizophrenia. There are two main classification systems used to diagnose mental health disorders. There's the ICD edition 10, which is mostly used in the UK, and then the DSM 5, which is mostly used in the USA. Yeah, so ICD 10 is used in the UK, DSM 5 is used in the USA. The two manuals do differ slightly in the way that they diagnose schizophrenia. So, for example, the DSM requires at least one of the main positive symptoms to be present for diagnosis, whereas two or more negative symptoms is sufficient under the ICD. AO3. Reliability issues in the diagnosis. Evidence which highlights reliability issues in diagnosis of schizophrenia comes from Copeland et al. Researchers found that there is low reliability in the agreement between different countries in the diagnosis. When psychiatrists in the US and England were given the same description of a patient, 69% of the US psychiatrists diagnosed schizophrenia, whereas only 2% of the English psychiatrists gave that diagnosis. These findings suggest that there are problems of using the criteria in other cultural settings, so it's not applicable. This also reinforces the issue of inter-rater reliability by using different manuals to diagnose schizophrenia. Further support of low reliability. One limitation of a diagnosis of schizophrenia is low reliability. Chinox et al. And two psychiatrists independently diagnosed 100 patients using both DSM and ICD criteria. The inter-rater reliability was poor. One psychiatrist diagnosed 26 patients with schizophrenia using DSM and 44 using ICD. Whereas the second psychiatrist diagnosed 13 patients using DSM and 24 with ICD. The inconsistency between mental health professionals and the different classification system is a limitation of the diagnosis. It also highlights that the diagnosis is not objective, but rather is subjective, and there are implications to this as it means that people may be misdiagnosed or may receive treatment may not receive treatment, and this reduces the appropriateness of schizophrenia diagnosis. A second issue involved in the diagnosis of schizophrenia is whether the condition actually exists, and whether it is distinct from other forms of mental disorders. A validity problem is that there is considerable overlap with other conditions such as bipolar disorder. People with bipolar disorder also experience delusions and hallucinations. Therefore, diagnosing a person with schizophrenia may lead to a faulty diagnosis, because schizophrenia shares these key symptoms with bipolar disorder. Another limitation is that two or more conditions could co-occur. This is called comorbidity. These include substance abuse and symptoms of depression. It may call into question whether they are actually a single condition. Researchers concluded that around half of patients with the diagnosis of schizophrenia also have a diagnosis of depression or substance abuse. In terms of classification, if very severe depression looks like schizophrenia and vice versa, it may be they are a single condition. This confusing picture is a limitation and reduces the validity of schizophrenia diagnosis. It also suggests that there's issues with the classification and diagnosis of schizophrenia due to comorbidity issues. One strength is real-life application. So, a real-life application that has risen from research and classification and diagnosis of schizophrenia is by introducing a schizophrenia spectrum, which could eliminate the problem of validity. This means that instead of looking at the presence of symptoms, the psychiatrist would focus on the severity of the symptoms that the patient is experiencing. This would increase the accuracy of diagnosis and effectiveness of treatment offered.